getting a headache.
Salam Iftikhar. Good to see you here.
Yeah, walaikum salam. I don't know who's listening and who's watching.
Yeah, I don't know.
How are you?
Good, alhamdulillah. You're doing well.
We're just going to be starting in a couple of minutes. So a few more minutes when we're going to start. Okay.
Inshallah. Are you staying busy?
Yeah, staying busy. Pivoted on to telemedicine a lot during COVID. So in psychiatry.
For your socialization. So, just a few more minutes, guys. We're going to be starting, inshallah. So just bear with us.
अंडे और दूध जरा ज्यादा है
All right. Good. One more minute. We're live on Clubhouse as well right now. All right. Just put this here. Right. So we're going to start, inshallah. Assalamu alaikum, everyone. Welcome to American Muslim Today's platform. I'm Dr. Amir Khan, your moderator today for the webinar. Today's topic is COVID-19 updates and mental health. This is a part of series from American Muslim Today. Before we introduce you to our distinguished lists of expert panelists that we have today, I want to start off by, first of all, thanking American Muslim Today and their team. They've been awesome. Thank you for organizing the event. We were going to play a short presentation by them, and then we'll start on by introducing the panel and so on proceed. So let me just play that. Sarah, do you know which one this is? Huh? Yeah.
Today, inspiring the leaders of tomorrow through our registered 501c3 nonprofit. These are the images of Muslims that you will see time and time again in the mainstream media. Muslims as aggressors or terrorists. Muslims as victims of aggression or Islamophobia. The overall impression is that Muslims just don't belong. But the media doesn't show images reflecting the real case of Muslims and the lives of approximately 25 million in the West, 3.5 in the US. You want to see how Islam is actually persecution and ethnic rulers of the world, including America, a true reflection of a nation. Studies show over a third of Americans have never even met a Muslim. Inevitably, they will rely on these extreme, polarizing stereotypes. So how do we challenge this systemic ingrained problem that's festered over decades? The only way to represent the reality of millions of contributing Muslims is to become stakeholders in the arena, to become gatekeepers of our own narrative. And that's exactly what American Muslim Today is doing. We're an inclusive, non-profit, digital news and lifestyle platform which celebrates the immense achievements of Muslims in Western societies. Using our pioneering public service journalists, we promote groundbreaking stories across all multiple platforms, learning and informing new generations of different races. Creators focused on the voice and inspiring Muslim conversation. Touch focus on the final portion of this. We also mentor budding journalists through internships and are committed to the multimedia literacy of young Muslims. By welcoming diverse voices within Islam and those of other beliefs through cross-community collaborations, we stress commonalities and promote religious tolerance. All this is made possible by the commitment of our hard-working staff and volunteers, who come from all backgrounds and ethnicities and include award-winning journalists and writers. There are so many ways you can support our registered 501c3 charity. Send us your stories and you contact writers, advertise, sponsor,
All right, fantastic. Thank you, American Muslim Today, for that presentation. We're going to start by introducing our panelists today. First of all, I'd like to introduce Dr. Fahim Arain. Dr. Arain is a consultant psychiatrist and medical director at the Royal Oaks Hospital in Windsor, Arkansas. He specializes in child and adolescent psychiatry. Dr. Arain, welcome to the platform.
Thank you. It's actually Missouri, Windsor, Missouri.
Windsor, Missouri. Apologies. I've been saying Arkansas before, so my apologies. You're right. Our second panelist is Dr. Umar Latif. He's a psychiatrist. He's a diplomat in psychiatry and neurology. He's triple boarded, mashallah, in general psychiatry. He's general psychiatry and addiction medicine besides neurology. He serves as the medical director at Carrollton Springs Hospital in Texas. So, Dr. Umar Latif, welcome to the AMT platform.
Yeah, no, thanks for having me here.
Our third panelist is Dr. Uzma Saeed. She's an infectious disease specialist. She heads the COVID task force and also is the director of the antimicrobial stewardship. She's in New York City. Dr. Saeed, welcome again.
Thank you so much.
Our fourth panelist is Ms. Sahar Zehra. She is the Director of Counseling Services at Compassionate Psychiatry in Frisco. She's also a licensed chemical dependency counselor and a licensed professional counselor. And she has a master's in clinical mental health counseling. Dr. Ms. Sahar, welcome to the panel.
So much for having me.
All right, and our final, one of our other panelists is Dr. Iftikhar Chaudhry. Dr. Chaudhry is a consultant rheumatologist in Dallas, Texas. He has been working in practice for about 20 years. He is affiliated with Baylor Scott and White in Texas. So, Dr. Chaudhry, welcome.
Thank you very much. Glad to be part of this discussion.
We have two other guest specialists as well. Dr. Mahesh Kodapalli, who's going to give us a little update. Dr. Kodapalli works also in infectious disease and works in DeSoto. He's affiliated with Methodist Manfield and Baylor Scott and White. Mahesh, welcome back again. Okay, you're muted, so unmute yourself next time, my friend. And then we have Dr. Mahwish Amir. She is a consultant nephrologist. She's joined us from Pakistan to give us an update after Dr. Kodapally gives us an update. So Dr. Mahwish, welcome also to American Muslim Today platform. All right, man. Okay, so I'll just start off by first of all doing a quick little update. Let me share this screen with you. As you know that we did a presentation on on COVID-19 vaccine facts and myths. This is a part of the series. Second part, mental health and other updates. Quick little video.
Amir, the audio is not at all good. You can't hear anything.
Okay, my apologies for that, but I'm just going to let it play, Mahesh, and then
Okay.
I'll give a quick little summary afterwards, all right?
And virus cell membrane fusion by binding to the human ACE2 receptor primarily on cells in the respiratory and gastrointestinal tracts. The virus enters the cell by direct membrane fusion and endocytosis, localizing the virus intracellularly within endosomes. The viral genome is then released from the endosome into the cytoplasm, where it is translated into viral replicase polyproteins, which are then cleaved into functional proteins. New viral RNA synthesis.
Okay, on the last presentation, I'm going to just quickly skip through this. We had discussed about or discussed the myths that were surrounding the vaccination. We had discussed about the messenger RNA vaccine technique. We also discussed that there is nothing that's implanted in the human body, and that everyone should go for Moderna, Pfizer, or whatever vaccination they can come across. This was a little schematic view. I'm just going to skip this. All of this presentation is currently on AMT's Facebook website. So if you want to access this, please do. The efficacy of the medication is very good. The Moderna and Pfizer both are very effective, and we've seen the effects and results of this. So I'm just going to skip through this and come to our current topic, which we're going to be discussing today a little bit, is about what is the current situation in America. And as you know, we're still having a lot of positive cases in the US, even though we're at a decline in the we're at a decline overall in other parts of the world. They were, and even though initially the BBC report suggested that the numbers were dropping, we did see a late surge in COVID-19, and especially one of the ones that we've been really closely following and been worried about is the surge in India. And this has been happening. So for example, last 3-4 weeks. We're going to briefly get a little update from Dr. Kodapally. The second bit I'm going to throw out there is what's been reported, or the reports coming regarding the anxiety and depression or mental illnesses that have been coming out, and reports that have been coming out. And as you can see from the diagram on the left-hand side, there's been a significant surge of these psychiatric illnesses, I want to say, even though anxiety, depression, and other mixed disorders have been reported. The ones that we're really, concerned about is the incidence of these depressive and anxiety disorders in teens. And then you can see that between the ages of 18 and 24, 56%, and then between 25 and 49, 48%. So that's a very startling figure there, and very, very concerning as well as the pandemic's effect on teens and the pandemic effect on especially younger population. We're seeing that, and we're also seeing that the COVID-19 has an impact on the physicians and other health-related co-workers. We're going to briefly discuss that in a second as well. Just before I start getting my panelists involved in this, I want to say that please do join and like the Facebook American Muslim Today. Also, if you can, Amazon Smile is another way where you can help and coordinate, contribute to America AMT's cause. Do leave a Google review and do send your email as well. So I'll conclude conclude this presentation, and then I first of all would like Dr. Kodapalli Mahesh to give us a little bit of an update on the situation in India. Mahesh. Can you unmute, Dr. Mahesh? Could you unmute, please?
Yes.
Okay.
Thank you for having me on, Amir, and hello, everybody. It's the second time I'm here. It's been a pleasure. My experience, I was in India, and especially Bangalore, because I do go there for teaching purposes. And I landed there on the 16th, and by 18th, there was chaos all around. The reason is because I think the new variant is a super spreader. It spreads easily, and there were several reasons for the spread. One thing is people got cavalier about the attitude about the virus, thinking that we South Asians are superhumans. We've been living around dirt and viruses and bacteria all our life, and we're super immune. We don't easily get the sickness kind of attitude. Initially, the first wave, everybody was scared, and then as the wave went down, that attitude somehow trickled in again. And the vaccines were available, but no one bothered getting it because they thought they're all superhumans. Hame kuch nahi hoga, hum top hain, kind of attitude, And then comes the religious congregations, and then the country went through elections. And massive rallies, nobody, maintaining social distance, and it was just everything. It's like, how do you say, whatever could have gone wrong went wrong. And the worst scenario was a lot of people got infected at the same time, compared to the first wave, where pockets of people were getting infected, and major cities were getting infected. And they were coming to the hospital. So there was not a shortage of hospital beds. There was not a shortage of oxygen to first run around, because the number of people that were infected were low. Because remember, the first time it was scary. As soon as the first few cases came into the country, everybody started wearing a mask, and people were careful, and the number of cases weren't that many. But then fast forward to second round. Like I said, because of the cavalier attitude of the population and the cluster of population, the densely populated cities, migrant workers, because it started off in one city in Mumbai, and then because people traveled between cosmopolitan cities from city to city, they were carrying it around, and there were some asymptomatic carriers, symptomatic carriers, and just it's spread like wildfire. So
Mahesh,
when that happened, can you hear me?
So yeah. So Mahesh, which city were you in?
Bangalore.
Bangalore. And
Bangalore is a cosmopolitan city. That's where the IT hubs are.
Yeah.
So you have a lot of international people coming and going. It's heavy construction going on because of this, a lot of migrant labor coming and going from different parts. And so what happened is suddenly on the 18th of May, a lot of people started hitting the hospital at one time. And they were suddenly not prepared. It's not like they didn't have beds. The hospitals were not prepared for this. Remember, after the first surge, everybody got discharged and the hospitals were pretty empty, actually. There were no COVID cases at all. So they were slowly coming back to their regular cases and, regular run-of-the-mill surgeries. And I think the hospitals were slowly picking up. Hello?
yeah, we can hear you. It's actually a It's Mr. Khan there. It's another.
Someone hijacked your thing.
Okay, finally. Thank you.
Yeah,
That was a good demo. All right, Mahesh, please. Okay.
So what happened was a lot of patients started hitting the hospital emergency rooms, and because the wave went away the first round, the hospitals weren't ready. The oxygen tanks were there, but the ICUs were empty, so they didn't think about keeping that full. Those oxygen plants that required regular delivery of liquid oxygen to the plants, and everybody's like life was normal like before, and nobody focused on this part. Industries were full swing, oxygen was being used elsewhere. So when suddenly all these people start hitting the emergency room, they suddenly realized that, hey, wait a minute, there is not enough oxygen available. And so it took about almost a week to 10 days for the oxygen to be streamlined. It's just not one city or one state. They have so many states and so many cities.
So
everybody
Mahesh,
got. Yeah.
So sorry, Ben. Sorry, I'm just gonna interrupt. I have a question. Couple of questions coming in. So when you came in, what was the latest loss situation, and how is it going now? Just give us a little brief update because we want to move on to the other panelists.
Yeah. So the situation is better controlled now. They were able to streamline the oxygen supply.
Perfect.
So they opened up a lot of beds. So it's much better now, but still the number of people coming in to the number of beds available is kind of still disproportionate. So it's still bad. But that's one part of the country. And then you have the neighboring countries, again, heavily populated, Pakistan and Bangladesh.
Sure.
And the worst scenario right now is for Ramadan is going on right now.
So
they are going to congregate, and it's going to spread like wildfire over there also. So the message is, don't trust anybody. Look at everybody thinking that he has COVID. Always wear a mask. If you can get vaccinated, get vaccinated. If you cannot get vaccinated, at least stay closed indoors. Don't congregate is what I've seen.
Thanks, Mahesh. I'm just going to switch over quickly to get a little update from Dr. Mehwish, just a brief update from Pakistan. Mehwish, tell us, you're in Islamabad, I understand. I know that India, there was a little crisis in oxygen supplies and stuff like that was a problem. Just give us a 30-second brief because we have other questions that we want to start asking the panelists.
Okay, thank you, Dr. Amar, for having me here. Well, about Pakistan, during the last wave, we actually saw a decline in the cases in January. But unfortunately, from March onwards, there was a gradual rise in the cases. And by the 10th of April onwards, there was a sudden rise in the positivity ratio on the daily basis. But fortunately, by the start of May, we are actually experiencing a decline in the ratio of positive. So much so that the positivity ratio that rise to more than 12% in April is now declined to 9.5 or 9% by the start of the May nowadays. So the positivity ratio has decreased, but there is no let up in the casualties as more people die of the disease who are hospitalized. The number of deaths have increased in the already hospitalized patients, but the positive cases have somehow decreased a bit.
Right. So thank you, Mavish. So it's a little under control there, I would say, right?
Yes, sir.
Okay, appreciate that. I'm going to go to ask the questions that we have some coming in, and I think I'm going to start off with Dr. The first question that's come in is, why are there so many anxiety
reason for my skin and how I shine and how my pores are so clear?
This is from Abdul. Dr. Fateh, would you mind just muting?
I eat ice cream. It keeps me young. It keeps me light on my feet. From activity of my job. I love my life. When you eat little babies, you'll wink, nod, and hug and high five each other with great enthusiasm.
Okay, sorry about that. I'm just going to have to remove. Dr. Fahim, first question, please.
I'm sorry, I couldn't hear the question. What was the question?
Sorry. First question is, why are there so many anxiety and depression during the pandemic time? Why is there so many anxieties and depression and other mental issues during the pandemic time?
Well, thank you for having me on the panel, Dr. Khan. Well, the way we describe, I mean, there are quite a bit of biopsychosocial factors behind it. You know, we look at the predisposing factors. In other words, patients who already had underlying anxiety disorders or depressive symptoms, we have seen during the pandemic, their symptoms getting worse. And then precipitatingly, the pandemic itself had an impact, and loneliness, social isolation, and we have seen a remarkable, as a matter of fact, latest statistics have pointed out that domestic violence, substance abuse, and you know, you just pointed out in one of your slides is that, you know, basically all of these underlying conditions have really gone up. I mean, they're really precipitated. So all of these reasons have been seen clinically in the hospital. The way the traffic, the patients are coming in, this is one of the most common reasons that we are finding out.
Thank you, Fahim.
Low socioeconomic condition is also considered, people losing their jobs, substance abuse, a plethora of issues that we're dealing with at this time.
Thank you, Fahim. Dr. Umar, would you just let?
Sure. No, I think what Dr. Ryan is saying is absolutely right, you know, about predisposing factors. In the mental health community, we're considering COVID as the black swan event for mental health. And we're bracing ourselves for a third wave. Once the actual immune factors settle down, we're going to unfortunately see a spike in suicidality, domestic violence, addiction, and COVID has acted as both an incubator and as accelerant. So I think one of the most important things is having these conversations about mental health issues. Even like Dr. Mahesh, what he mentioned, a really good point was, you know, if we don't educate ourselves on what these illnesses are, and then I'd go a further step, if we don't educate ourselves that mental illnesses are medical illnesses, we're at risk then of not doing preventative care. And unfortunately, we will see, not to be an alarmist, but to be a pragmatic kind of foreseeing things, we're going to see a lot of spike in mental illness issues. And having conversations, having community healing circles. Dr. Rania Awad, who runs the Stanford Muslim Mental Health Lab, she does a really good job in all of our communities here stateside on running these healing circles have questions. There's no question that should be taboo. You know, unfortunately, in our community, the S word, the suicide word, is taboo. We think it's someone else's problem, and we need to have an ease in talking about these things and knowing what the resources are. I think one of the things I would ask the American Muslim Today is on their website, just have a link for resources for mental health, for the suicide hotline, and what your local community resources are, and just keep these conversations going. I'll be glad to take some more questions afterwards. Thank you.
Absolutely. That's Dr. Latif, a good update. Appreciate that. A second question that's come up, and I'm going to put it to Dr. Latif and Dr. Arani again, is what can parents do for children who have been shut down home and have been isolated? For children, how do we integrate them back? I guess that's the second part. And how can we integrate them back into schools and public life? Dr. Latif, why don't you go first, and then Dr. Fahim can chip in.
Sure. I'll defer to Dr. Ryan being the child psychiatrist, but one of the things I would say is that even before we're integrating them back in life, I think the time is right now, even while people are still at home, continuing to have these conversations. Unfortunately, our DFW community experienced 2 really horrific events recently, and the main message was having conversation with children on, you know, you heard about it on WhatsApp, you heard about this thing on Facebook or stuff. Let's talk about it. How did this make you feel? I mean, was this a normal event or an abnormal event? Do you know of any friends who might be suffering? What advice might you give them? So again, having those active conversations. My son's part of YA, which is a local youth community for Muslim children, and they're running these topics right now. And it's children-led, adolescent-led. So I think the more we normalize these conversations, the more we can, inshallah, prevent adverse effects. But I'll defer to Dr. Arain for some more specifics to child adolescent.
Dr. Fahim.
Thank you. So, yes, Dr. Latif, very well said, an open dialogue and a communication with the children. You know, we know our children better than anybody else. So parents should be well aware. But what we tell them as an expert is that you need to know cognitively or developmentally where they stand. So the concept of death develops at age 7. And this is considering it's a normal developmental trajectory. So a child at 7 years of age understands that when a person dies, never comes back. However, suicide rates, you know, are lessened prior to age 7, but you know there are reported cases of suicides too, which are considered copycat suicides. You already covered that in your earlier presentation. What we have also seen is, clinically speaking, is that children who were already had underlying issues, psychiatric issues, learning disability, ADHD, mood disorders, and who were doing hybrid learning or were online educating themselves, their issues tend to be really precipitate. I mean, there was literally a lot of problems that we were dealing with parents providing them supervision. I mean, here they were, these children, frustration tolerance has really, really gone down because, you know, they were earlier at school working with.
Dr. Fahim, you got mute. I'm going to pass on the question to Sahir. Sahir, would you elaborate on what would you recommend for children who are home and been isolated? How do we integrate them back into school and public life?
Thank you for having me. I think it's really important for us to recognize the social needs of our children, their emotional and mental health needs. So as we're thinking about how can we help them to continue to stay connected socially and build that type of those skills for themselves, and how important it is for their levels of depression and anxiety to stay connected with their peers. As we're all starting now to get vaccinated and thinking about integrating back into sports and events at the mosques and back to school, I think it's important to allow our children to be aware of the situation, right? We want to continue to socially distance a little bit, but also let them know that it is safer now. A lot of children have developed higher levels of anxiety about socializing. And I think just to reiterate what Dr. Latif and Dr. Arain are saying, keep these conversations open. Get a better understanding of how your children are feeling about the situation, what anxieties they might have, and not to be afraid to reach out for professional help. There are a lot of Muslim therapists in DFW, mashallah. This community is really amazing. They've developed a network, and it's called MAPS Network, and their website is mapsnetwork.org. Muslim Association of Psychological Services, where we have a group of fantastic therapists and social workers that are very well aware of the stigmatization that we deal with in our community regarding mental health.
That's very good, Sahar. So there is a network, we can reach out to these network groups. If you get a chance, please do write that in the chat, in the Zoom, so people know where that is. There is there's another follow-up question which I'm going to ask, but I'm going to get Dr. Chaudhry and Usman involved in this question. And this has been come up a couple of times. I'm vaccinated, I'm vaccinated, but I'm still scared of going out. What would you recommend? Dr. Said first. I'm vaccinated, but I'm still scared of going out. And I think the question part of it is that a lot of people have still not been vaccinated and herd immunity is not reached. So what would you advise this specific person?
Yeah, absolutely. That's a great question. Thanks for having me here. So, the point that you made is absolutely correct, that we haven't yet vaccinated the majority of the population. And so although we are making so much progress lately, unfortunately, we have seen a decline in vaccinations, and there is still a good amount of virus that's prevalent in our country and in our communities. So what I usually tell people is you have to really look at, the host factors, right? It's very individual. So if you have somebody who's very low risk, has no medical conditions, and essentially their bubble and their interactions and their family is also low risk, then, they may feel a little bit more comfortable going out, venturing out, and, kind of acclimating into society. But you have to look at, if you have somebody as opposed to who is more high risk, immunosuppressed, and you're looking at now a person who may not be able to mount that good immune response to the vaccines, that person has to still take all of the precautions despite being fully vaccinated, despite being 2 weeks after their vaccination. You have to really assume that this vaccine may not be effective, and until that level of virus in the community is really low, you really can't let your guard down. And I think the case in point that we have to remember is, this is something that we're going to have to live with for a while now, until we reach, again, herd immunity, whether it happens in our country eventually or not. We have to remember that, we are all in this together, and look at the entire globe. Prime example is what's happening in India and Southeast Asia. With globalization of travel, this virus is going to continue to keep circulating back and forth. And with low and middle income countries that are not going to have access to vaccines till 2023, 2024 even, this may be our reality for some time. But what we really can do is to really get ahead of it again, still get as many people vaccinated as much as we can, as quickly as we can, to keep these variants from emerging. But always just kind of have that in the back of your mind that, there is still some level of risk based on, your host, your immediate circle, and, where you're bringing the virus home to.
Perfect. Dr. Said, thank you very much for that. Follow-up question, Dr. Iftikhar. I'm pregnant and I'm fasting. Can I get vaccinated? I know you've been asked the religious component of questions in the past, but this is another question similar.
Yeah, so with the disclaimer, I'm not a religious scholar.
You said that last time, but the question still came to you.
Sure, that's fine. So first of all, thank you very much for having me. And as far as there's a need for vaccination, whether you're fasting, not fasting, or injection is needed, or antibiotics is needed, you can get it, whether you're fasting or not fasting. So that's not a concern. If you're expecting, still the American College of Obstetrics and Gynecology recommends to get the vaccination, so you can have the vaccination safely. And there was one more question. There's a follow-up answer to the question we had last time: which vaccine should we get? So there's a fatwa came from the jurists in America that was that the vaccines which are made from dead human fetus, should be avoided if you can. So vaccines like Pfizer or Moderna are probably preferred, and we saw their efficacy actually is also better. And another comment I want to add is about the variants that we are very concerned about. These Moderna and Pfizer vaccines also are able to take care of 75–85% of variants. So these are very effective vaccines, so should be probably preferred. But however, if you cannot get any vaccine, and what you have is, let's say, a J&J, a Johnson vaccine, or AstraZeneca vaccine, then go ahead and get it, because it's best to get vaccinated. The only way that we are going to be able to save ourselves, our loved ones, is to get vaccination done. And this vaccination should be done globally, all over the world, should be done within ourselves. And again, I think part of the question was also that what should we do in terms of being scared going out? If you get vaccinated, if you got your 2 vaccines, you should still use your precautions, wearing the mask and wash your hands. But you can go out, keeping your social distancing. And the depression is very common, and we see a lot of depression in our own families, in our own communities, in our own patients, everywhere. So that should be addressed given the proper precautions that are being taken care of.
Okay, thank you, Dr. Chaudhary. A follow-up question for Mahesh. I'm going to ask quickly, the strain, the talk about the Indian strain, and there are cases in Houston, there were 4 reported. So this person is asking, should I be concerned? And I know there's a travel ban right now from people coming from Pakistan, from India, but they're also already reporting cases of the strain. Mahesh, just briefly about that. Is this strain any different from the strain that we're seeing from other parts, for example? First, Mahesh.
It doesn't matter which strain, the illness is the same. The only difference in the strain part is how rapidly it's spread. The virus, the development of change in its antigen it's easily contractable. That's the only thing. But the illness and the sickness is the same. And the treatment is the same, nothing changes. And before I go off, I just want to give a brief statement that there is a myth and a confusion that if I'm vaccinated, I'm not going to get the virus. I just want to let you know that vaccination doesn't protect you from getting the virus. It only prevents you from getting killed. You'll not be that ill. The reason is, I'm a prime example. I got vaccinated in December, January, and then February, and I got the virus. Very mild symptoms, just a loss of taste, but I still got it. So I quarantined myself. So I'm just letting everyone know that don't assume just because you have a vaccine, you have a free ticket to go and party. No, it doesn't work like that.
Appreciate that. That's a very good point.
Can I just chime in there? Thank you so much.
Sure.
Saying that, I just want to also just encourage people to get vaccinated, though, you really, even though we know that these vaccines may not prevent, illness, but it will prevent severe illness and hospitalizations and deaths. And that's really the goal that we want to reach right now, especially when we're more than a year into the pandemic, where we still do not have that magic bullet or the cure for this novel virus. So, vaccination is really the strongest tool that we have in our toolbox right now. So I think it's really important for people to keep pushing forward and get vaccinated as soon as you can, because this is really a life-saving measure.
Appreciate that. This is a question that I'm going to ask all my psychiatrist panelists, including Dr. Latif Fahim and Seher. How to handle religious blasphemous thoughts while quarantine. Can someone give some advice regarding this? Let's put this to Seher quickly, and then if the other guys want to chip in later on. Having thoughts while quarantine, and this is, Fahim, you could answer this from a kid's perspective later on, but I'll start off with Seher, please, quickly.
Sure. So anytime that we're having any kind of negative, unwanted thought patterns, it's important to remember that those thoughts are not facts necessarily, and to not guilt and shame ourselves for having a thought, right? It's more so about what we do with that. So we have the ability to take more control over that thought pattern and recognize what are the emotions that I'm going through that might be leading me down this thought pattern. And there was something that Dr. Latif mentioned in the chat box, that let's not wait to get diagnosed and seek professional help. It doesn't have to be the last resort, right? Preventative care therapy is such a huge part of taking care of our mental health. So seeking professional help before things start to spiral or we feel like we're really in despair is a great way for us to build those coping skills and understand how to handle those negative thought patterns.
Perfect.
As far as this happening specifically in quarantine or isolation, quarantine can be very difficult on a lot of people. Reach out to your loved ones, reach out to whoever you can, and have a conversation about it, because holding on to all of those thoughts allows them to build. We cannot suppress those necessarily.
That's a great point. Start off with conversation, whether it's friend, family, parents. That's a take-home message from this talk today. Please open up and start talking. Fahim, do you want to add a point or two? And then I'll have Dr. Umar add a point or two regarding this. It's very critical. Kids having thoughts, there's suicidal ideation coming when they're quarantined. What would you suggest? Any tips, any follow-ups to that, and some practical measures? Point or two if you have in your mind that you can add to Sahar's point.
I guess one of the things that I would just like to point out is the the explosion of information, not right information on social media, and misinformation, so to speak, I should say. And a lot of people are just they're being influenced. They're highly suggestible, and
Sure.
they don't know the right from wrong, and they believe it like anything. Like
Sure.
I've had many conversations with the families, and I've tried my level best to give them the scientific data, explain to them. And I actually showed to them that, listen, I'm one of the providers myself, and I got myself vaccinated. But this misinformation is highly, highly devastating. So that's one of the things that I've seen with the families, and education is the only way to move forward. I mean, I hope it made a difference, and the families that I spoke with finally got vaccinated. But that was one of the things, is we live in an information age where rumors and negative information flies off. And if someone already has an underlying problem, it can get worse. And if people are highly suggestible, that can make actually things even worse for them. So
Thank you, Fahim.
that would be the one thing I would like to say.
Thank you, Fahim. Umar, what would you recommend to kids, grown-ups, but especially kids? Any tips, any measures for them, for parents who are concerned? Because I had a follow-up question. I'm a mother.
Sure.
My kid has been isolated for over 6 months, and he's now doesn't want to come out of his room.
Yeah.
Tips or measures would we suggest to mom? Hey, this is a COVID. They're very scared. What should we do?
Sure. So first, I want to thank the audience member, Abdul Jabbar, for asking this question, because it takes courage to ask these questions. What this question opens up a window is what Sahar had mentioned, and Dr. Ryan, that psychiatric symptoms or mental health symptoms are medical illnesses. If a person comes to you and says, I'm having stomach ache, you're going to seek a medical professional's help. Is it heart issues? Is it an ulcer and stuff like that? So having blasphemous thoughts as a psychiatrist, I'm immediately thinking functional impairment. Is it just your garden variety anxiety? Is it obsessive compulsive disorder? Is it a delusional disorder? Is it blasphemous suicidal thoughts, homicidal thoughts? And those array of thoughts are sufficiently complex that they demand a formal assessment. These are not curbside water cooler kind of conversations. And the word that we use in mental health is functional impairment. If these thoughts are impacting your day-to-day life, I've got a patient I'm seeing, young patient, her intrusive thoughts are so severe that she is spending 1.5 hours doing Badu, and she's missing Asr, and now it's already Maghrib time. I have another young adult who's having blasphemous thoughts about Vadaniyat, and really just kind of thoughts that are very erroneous, and are they also going into psychiatric realm? So it takes courage to ask these questions. My advice would be for keeping time in mind, is seek professional help when you're asking, for these symptoms.
That's a very good point. And I think just generally in our culture, in our cultures, whether it's India and Pakistan, we tend not to discuss this. And I see here another question as I'm a man and I am ashamed of expressing that I feel down. So how do we answer that question? Sahar, what would you suggest to this person? I'm a man, I feel down, but I'm ashamed to say so.
Yeah, absolutely. There's a lot of stigma within the Muslim community, and for men especially, to talk about their feelings, to say, you know, that vulnerability is seen as a weakness, and actually it takes so much courage for us to open up and really just discuss how we're feeling. I think it's really important to remember that the entire range of human emotions is normal. It's normal for us to feel anxious, scared, sad, grief, especially through this pandemic year that's been unprecedented for everybody. It's okay for us to find somebody within our circle that we trust to start that conversation. And if we don't have somebody that we trust with that information, reaching out to an imam, a therapist, your PCP, if that's where you want to start, your primary care physician, and recognizing that it is okay. That's really the first step, to say, it's okay for me to feel sad. I don't have to feel guilty or ashamed of that emotion.
Thank you very much. That's a very good reply. A question for Uzma, for you. Is it safe for me to travel? First, I would say travel within US, and then I'll ask whether they can go abroad. I don't know if they said local or abroad, but can I travel? What would you suggest to this? What would you suggest?
Again, it kind of goes back to that first question where we talked about, you know, a little bit about risk stratification. So again, you know, with vaccines and having the access to vaccines that have been proven to be safe and effective, you know, we are making a lot of progress. But if you look at traveling in general, you have to look at first, are you traveling somewhere by car, which is going to be a lot safer than traveling somewhere by plane. But again, you're thinking about large crowds, you know, who are you surrounded by, being in a confined aircraft, you know, who's on that plane with you. We know that people are not required to get tested before flying necessarily every single place that they're going. And, you know, there is that time where the masks may be off of people. And we do know that this is, you know, not only a droplet virus, but it's transmitted by small aerosols. So you have to look at, you know, all of those things, you know, how much risk are you willing to take and how risky is the behavior that you're partaking in? If you're traveling to an area that has less virus, you know, in the community than where, you know, where you're going to, then that's obviously safer. If you're, you know, you have to just look at all the different things and try to modify as much as you can to make sure that you have the least amount of risk. You know, if things come up and it's emergent where you have to travel, then you're going to take all the precautions that you can. Make sure that you're fully vaccinated, you know, make sure that, you know, you're trying to travel on off days where they may be, you know, less passengers. If, you know, there are still some airlines that are blocking those middle seats, that's, you know, makes it safer. Again, it's all about how much risk are you willing to take? How much risk, you know, can you handle as a person based on your personal medical history? And based on, you know, what's happening globally, I don't think it's really advisable to travel internationally right now unless it's an absolute, you know, necessary emergent kind of situation. Most of the world is not vaccinated. Our own country is really not, you know, there yet. We have made so much progress. You know, we have 150 million people that have at least received the first dose of the vaccine, but, you know, we still have a ways to go. And if you think about, you know, we are really leading in the vaccination effort, but the rest of the world is nowhere near that. So we really have to assume that anybody that you encounter could have this, this virus. And despite being vaccinated, as we mentioned before, you still could contract the virus. And we have to remember about breakthrough infections that happen. And until that level of virus is low in the community, you just have to take all the right precautions. And traveling is just, you know, again, you have to risk stratify and see, you know, are you able to go somewhere where the weather is nice and be outdoors where it's less risky as opposed to being indoors.
Thank you, Uzma. That's sums it up very nicely. I have Dr. Shehzad from UK. Dr. Shehzad, thank you for just joining. Just give us a quick little update. Is it safe from US to travel to UK? Dr. Shehzad is a general practitioner in Homerton Hospital, I think, in London. Dr. Shehzad, if you could unmute yourself and just a brief response to that. Is it safe to travel to the UK now? The UK had its surge. It's on the mends now. How are you guys doing there?
UK, we are, Assalamu alaikum everybody. Thank you very much for Amar inviting me for this panel. I know you tried a few times before, but unfortunately, I was working that time. I couldn't join it, but today is my day off. I'm sitting in my home. Sorry, as a Kayil dress, not like
Yeah,
you.
that's okay.
Dress. Yes, UK, I can say from last about 3 weeks, I work in the Homerton. Homerton is in the east side of the city hospital, one of the worst affected area by the COVID, unfortunately, because of is mostly mixed community. Asians are black, so they are the highly affected in London even.
Sure.
Yes, we are improved very well now, and definitely from last 3 weeks, our numbers are decreased dramatically. I would use this word, sorry, because it was not happen last time when we are at the end of the first surge. It come very slowly, but this time very dramatically, very removed. I mean, there are all the wards in the hospital previously was turned into COVID. Even the pediatric ward, which is almost 70 bed, we turned into COVID before, and we use neonatal ward for the both of them. But now the condition is this: that from last 3 weeks, almost our A&E, which I work actually, there is no red. The first green and red zone. There is no red zone.
Perfect.
So there's open and only one room left for the patient. From last 3 weeks, I haven't seen a single COVID case.
Excellent.
Previously, mostly cases, 90 plus percent cases was COVID, which I was seeing myself with my other colleagues.
So
But,
safe to travel. So you're
safe. I would say we are waiting for 17th of this month when it will be open most in a wider aspect, allowing most of the things. So hopefully.
So Dr. Sale, we're not sure of traveling to Florida, for example, but we know we can travel to UK now.
Definitely.
Florida is still open, the vaccination not happening, yes. But UK, we're safe to travel. That's good.
I'm telling you truly, absolutely. I couldn't believe it myself. If you asked me this question about 3 weeks ago, I would say same thing like everybody's saying. Please don't travel because there's a lot of new variants, a lot of things are happening. But no, I am dramatically, I'm looking around myself. No, it's big difference. Thank you. Yes, definitely safe.
That's good to hear. Mavish, safe to travel to Pakistan? You got to unmute yourself. Is it safe to travel to Pakistan right now for you guys?
As far as traveling is concerned, yes, I would say they are safe enough to travel to Pakistan nowadays, because as I previously mentioned, from the start of the May, we are experiencing a downward trend in the positive cases of COVID.
Okay.
So, and a smart lockdown has also been implemented from today onwards, especially during the Eid days. So we are just homebound these days.
So safe to travel, but you're going to be quarantined, so it's not that much of use. Okay. Mahesh, what about India? Would you go back? Is it safe to travel or not yet?
No, absolutely not.
Absolutely.
Absolutely not right now. But I am going back in June again to help out. So
you're a man.
I mean, well, first of all, they're not letting anybody in unless you have a special visa.
Gotcha.
For a medical thing. You know, then you need an invitation from there to say, hey, I'm coming on a medical mission. But so other than that, regular travel is not allowed.
So even though you're vaccinated and protected, unless it's an emergency, don't travel. Is that what the message we would give?
Absolutely. Absolutely.
Perfect. Dr. Chaudhary, another question. This is again on the Ramadan thing and vaccine. Can I have, what age group are we looking at now to vaccinate kids? I know there's Moderna, Pfizer, 16-year-old and 18-year-old, but what age group should we start looking at of vaccinating? Dr. Chaudhary first, just briefly.
So just, okay, I want to just patch up with the travel advice that just want to be comprehensive on that. So patients who are on multiple anti-suppressant medications or the immunosuppressants they are taking, especially certain type of immunosuppressants such as rituximab, you know, they don't mount good response to antibody when the antibody shots are given. We do check their antibody levels and we don't see them. So patients who are on multiple immunosuppressant medications, and if they want to travel, you know, again, this is not the FDA or CDC recommendations, but with my own experience, I would say that check your antibody levels, SARS-CoV, you know, IgG, IgM levels, check them before you travel. if you are on a tuximab or serious immunosuppressant medications such as mycophenolate or Orencia. So things like that you should do before you travel to be sure that you're going to be safe when you travel. Especially if you're traveling overseas, you got to make sure that you have your antibody testing before you go. So that's one thing. The age for the vaccination. So I'm very hopeful that next week we're going to have the approval of our Pfizer vaccine to be used in kids from 12 to 15 years of age. So hopefully next week we get the approval. And then again, I'm a strong proponent of vaccinations. So get the vaccination done, whichever vaccine you can get it done. Again, in my own experience, preferable vaccination will be with Pfizer and Moderna.
Thank you very much for that, Dr. Chaudhary. There's a question, I'm going to go back to Sahar again. How do I get my child, how can I convince my child to get counseling? I know something is not right. He's not agreeing to it. How do I do that? Sahar, what do you recommend?
Yeah, that's a fantastic question. And I think that to really convince somebody to do anything, we need to understand why they're resisting, right? So to understand what the resistance is he feeling like there's some stigma there that he's fighting against, or he's afraid to open up and be vulnerable?
So say he doesn't want to talk. He's just withdrawn, doesn't want to talk. These are two similar questions. How do I get them to talk? How do I get them to open up and talk?
Mm-hmm. Yeah, absolutely. So again, understanding what is that resistance to talking about it. I think therapists and psychiatrists who work with children and adolescents are very well equipped in handling resistance. We see a lot of patients who are resistant, who are there because their parents are really wanting them to be there. And so really making that appointment and getting in front of a professional with your child, and then allowing the professional to really kind of take over and do their job might be the best way to do that if we're experiencing a lot of resistance.
Thank you, Sahar. Fahim, any tips or tips regarding that? How do we get, there is a child who is withdrawn in a room, the mother can't get him to do anything. How do we get him out to do counseling? What would you recommend?
I educate them, I educate families that, there's a lot of shame, guilt, and stigma, as Sarah's pointed out exactly. But I tell them that okay, well, it's just a discussion, an open-minded discussion about events, and the family approaches the child saying that, okay, we need to understand what's going on, and perhaps as a family we need to understand things better. So I suggest the family comes in. So if the child is having a hard time coming in himself, the whole family does it. So child and adolescent psychiatrists, actually, we work with the families. And that really helps to break the ice. And I've seen that very effectively.
So get the family involved all together is very important.
Yes, sir.
That's family abroad. Umar, any recommendations, any tips? This is for mothers and family.
Yeah. No, I think those are excellent points. Understanding what the resistance is, and then having a conversation as the parents with the professionals. I will add something very specifically, again, to break the taboo of these conversations. And Sahar or Fahim, please feel free to join in or add to this. But we also need to know what our community resources are for emergency psychiatric care. Because again, psychiatric illnesses, just like medical illnesses, are on a spectrum. If someone's having a heart attack, that is not a point of time you're going to take them to their family provider and get an appointment for next Monday. You're going to call 911 and go to your local nearest emergency room. If at any point you feel that the young child or adolescent, they're either exhibiting behaviors that might be indicative of harm to self or others, at that point, knowing what your local resources are to seek emergent care, because the burden is not on the parent then to figure out what is the level of severity. So I just wanted to add that one more thing. And when in doubt, call 911. So there's a lot of taboo in our culture. If we involve 911, Child Protective Services gets involved, especially in the United States and stuff, and all of that. Those are myths out there. These are support systems that are available as a resource to prevent, God forbid, unavoidable, outcomes.
Consequences of that. Appreciate that. Follow-up question. Is it okay to have suicidal thoughts once or twice? Is it okay?
Sure. So no, that's an excellent question. Let me jump in on this. Again, everything is on a spectrum. The presence or absence of a suicidal thought is not an abnormal thing. There's actually clinical studies that have shown a vast majority of them have had an intellectual thought come in. You know, I just saw something on the news, or I saw some of my friends who had an uncle or an aunt do this and stuff. The key thing is what happens once that thought comes in. A cascade event has to happen. That thought has to be communicated to a loved one, to a trusted person. You know, I'm going to go in an extreme case here in our world. We ask this differentiating question: when you're having these thoughts, are these thoughts that I don't want to live, or are these thoughts I don't want to live like this? And majority of people, when these thoughts are severe, recurrent, intrusive, it's not a thought about wanting to end your life. It's an inability, becoming overwhelmed in managing whatever life stressors are. So again, yeah, so the thought comes in, seek professional help without a taboo. Sahar or Dr. Rain, if you want to add to that, please.
Yeah, so exactly. And I would just like to add on to it that yes, these suicidal thoughts, when we are assessing them, we tell them that a suicide, fleeting negative thought or a suicide thought can occur. How long has this been going on? When was the first time you thought about it? What were the triggers? What are the underlying reasons of why you had those thoughts? And did you think about ending your life, or what were the plans, or to what extent did you carry those thoughts to? So a full evaluation really comes in.
So at what point do you become concerned that this suicidal idea and thought is, okay, this is a red line, this is very serious, because it's just serious now, you should get some help?
There are a lot of warning signs. As you know, the panelists would agree with me, suicide is one of the most hardest things to predict. And whenever someone talks about this, if an adolescent or teenager opens up and confides with someone, with a counselor, we take serious action and we intervene right away. So we assess them because we don't know how long they have been thinking. So the best way that Dr. Latif has pointed out is get professional help. But well, it's, again, the name of the game is functional impairment. There are a lot of warning signs. What else is the child doing? Are the grades suffering? Or there have been other factors involved: bullying, social isolation, hopelessness. A male gender, by the way, that's one of the most important things. 3 times more likely of committing suicide if someone is a male as compared to a female. And access to firearms. Firearms are,
Good point. Good
as
point.
Americans, firearms are around us.
So don't be around. Make sure those firearms are safe. I just want to tell my panelists, I know Umar is responding, Sahar and Fahim is responding to Dr. Chaudhary. There are some questions coming in the chat. So if you want to answer them, please do so. Some of them we're going to get to, some of them we may not get to, unfortunately, because we're running out of time very quickly. So Sahar, do you want to answer that question, the last one, which I think is very important, right, about the suicidal thing and the fact that it's not discussed in our communities, but yet we see threats all the time, men and women expressing those. And so when is the line to be drawn? Fahim pointed out that, you know, whenever you mention it, we should take it seriously. Dr. Latif mentioned, okay, anytime you should go out and seek help. You should get help regarding that. And then the social services, he mentioned that they're not out to get your kids or from you. But yet in our community, we all are very afraid and we're not going to go out to get help. I'll tell you up front. And no matter how many times Latif, Umar is going to say, yeah, go out, go out, go out. The community is not going to go out for that purpose. We're very scared and we lose our kids. Sahar, could you elaborate a little bit, just a little bit on that? And then we're going to move on to 2 other quick little questions, because this question is very important.
And Dr. Latif said, we cannot be afraid of utilizing the community resources that we have. And that's what really leads to us isolating in these situations. I would say that if the situation is not imminent danger, right? If we've assessed and we have somebody saying that I have had a suicidal thought, but it was a fleeting thought and it's making me really think about my depression and how I'm struggling, that's the time for us to really engage in some mental health first aid. There's actually a fantastic website called mentalhealthfirstaid.org that can be a great resource to everybody to kind of walk us through what are steps that we can take as family members and friends and loved ones to help someone who does reach out to us and open up to us. So the steps in those cases are really going to be to empathize and to listen non-judgmentally, give reassurance and information to that person, and also encourage appropriate help. Dr. Latif made a great point, right? If somebody's having a heart attack, that's not when we're going to go see our primary care physician. In the case of imminent danger, call 911, right? If we know that somebody is really spiraling and they are have access to firearms and that they've been struggling for a good bit of time with this issue and have not sought any kind of help, or maybe they have sought help, but that has not really been the answer to what they've been needing. Let's utilize those community resources because suicide is preventable, right? We have to be listening. We have to be looking for those warning signs.
So the panelist is saying when there is a line,
mm-hmm.
if after that line and it's a serious case, please get the community services involved. You don't want to lose your loved one. Follow up to the question, again, another one on this mental health issue is mental health experts, how do you cope with handling severe mental health cases? Have any of you dealt with a patient who you treated and then later on killed themselves?
So I will say that I've been fortunate and I haven't experienced that, but in our field, it's very common I think the statistic is about 72% of mental health professionals go through losing a patient by suicide, unfortunately. So for us, our secondhand trauma is real, and I encourage therapists and mental health professionals and anybody in the medical field who deals with losing patients to also seek therapy. It's very important.
Dr. Umar.
Yeah, so that's a real that's what we sign up for, right? It's just like an emergency room physician signs up for work where not everyone will survive. But alhamdulillah, it's a calling. I've experienced patients who've completed suicide, who've attempted suicide over the 15 years. It comes with the territory, and that's where good training comes in. But no matter how much you're trained, the first time one of your patients passes away, at the end of the day, we're human. And we have to practice what we're preaching, which is then in that point, find good mentors, find a good buddy, find a colleague, have your own circle of professionals where you can talk about how this impacted you and stuff. COVID, unfortunately, is increasing the risk of suicide amongst physicians. COVID is increasing the risk of burnout, vicarious traumatization, that sense of moral injury and helplessness. So again, one of the things I tell my patients is, it's not like, here, take my advice because I'm not using it. I have to practice myself seeking counsel of trusted peers when things are becoming challenging. So Dr. Ram.
Thank you, Dr. Latif. And yes, intense guilt, guilt by providers is one of the things. Now, thank God, alhamdulillah, I haven't lost anyone as well, but I've had an adolescent who possibly had an accidental overdose, which was found out later on by the family that it was not a suicide attempt, but it was something that we processed. Countertransference was intense, and we processed, as Dr. Latif pointed out, with the mentors and with other fellow psychiatrists to discuss. It's what we call psychological autopsy. We opened up the case, we discussed the case, and to help ourselves and help others, and to make sure that we try to prevent it. And once again, we even if we have the best possible effort that we put in, there are some cases which can be very, very difficult. I don't want to say impossible, but difficult. So yeah, that should always be kept in mind. Dr. There was just one thing about community engagement I wanted to point out. I live in Kansas City. We have Islamic Center of Greater Kansas City. It has actually a clinic that is, it's a multidisciplinary clinic, and we volunteer services over there. We try to engage the Muslim community through that, and we provide them education. Stigma is an active issue, but that's something that I wanted to point out, that mosques and Islamic centers across, which alhamdulillah now we have.
That's a good point.
They can also get engaged. So where there's congregation for prayers, they can actually open up and educate people about mental health. And say, well, you don't have to go far. You've got a doctor right here, just next door, you know, after the prayer.
That's a good point. So seek out, get help wherever you can. And whether it's a community mosque or a mandar or a masjid, just reach out. Look, guys, I still have quite a few questions with me right now. I don't think we're going to be able to answer any more of the questions, and some wanted to ask live. I just want to take this opportunity to thank you all panelists for joining in. It's just been a very engaging discussion, and we've already 15 minutes ran over our time. Please, all of you, I'm going to ask the panelists to leave their emails, and if some of you guys want to ask them a question later on, please, Fahim and Umar, type your email in the chat that is there. There are some questions on Facebook and stuff where we'll try to get them. If the questions are there, we'll cross over and send you the email. Please, everyone, don't forget to support, I guess, AMT with their Google reviews. They would appreciate that. Send your emails. That would be a good part. And even if you could make an Amazon Smile, in Amazon Smile, assign AMT as your charity. Remember, it's a 501c3 nonprofit organization that's just helping our community out, and is planning to do more events like this if you guys continue to support. I'll conclude. Thank you very much. Very thoughtful, very useful. Thank you for Mahesh from giving us an Indian perspective. Mavish, you being there 1 in the morning. Thank you very much there for coming on and giving us an insight from Islamabad, and Dr. Suhail giving us an insight from London. I appreciate you all being here as a panelist. Dr. Chaudhry, we always love to have you. Thank you very much for coming in and joining again. And Dr. Latif, Fahim, and Sahar, very engaging. Appreciate it very much. If there is any other comment or anything you want to say, please do say. But until next time, Assalamu alaikum from us.
Wa alaikum salam. Thank you.
Awesome. Thank you very much.
Wa alaikum salam. Thank you very much. Bye-bye, everybody.
Thank you. Thank you, Mahesh.
Thank you. Just one last thing. Please get your kids vaccinated. Don't hesitate. My son got vaccinated. He's 17. My daughter got vaccinated. She's 19. They're doing fine. So get your kids out there. Get them vaccinated, please.
We will do.
Just to say note, Mustafa got vaccinated today.
Oh, very good. Very
good. 16, yeah.
He's 16 now, right?
Yeah.
Absolutely.
Good to BHA, get the vaccination.
Absolutely. Get
Thank you, guys.
It doesn't matter if it's Johnson & Johnson. There was a panel question about Johnson & Johnson. Just get any vaccine. Get yourself vaccinated. England will get Pfizer. I think it's AstraZeneca. We'll get Pfizer, Johnson & Johnson, or whatever one we can get.
Thank you.
Thank you, guys. Thank you, everyone.
Thank you, Amr and AMT, for arranging this. Really enjoyed it. Thank you.
Thank you. It's our pleasure.